Hello, this is Dr. Howard Goldman, and I'm beginning this presentation on behalf of my entire team at the Cleveland Clinic. We're happy to participate in the online ICS 2021, and we really hope we could be live again next year. We're going to spend the next few minutes talking about our research on sacral neuromodulation in Parkinson's disease, what we have found to actually be an effective avenue of treatment. These are my disclosures. And at this point, I'm going to hand it over to Dr. Sarah Martin, who's the lead on this study, to go over the rest of our findings.
Thank you for that introduction, Dr. Goldman. As he said, my name is Dr. Sarah Martin, and I am the lead on this study. Parkinson's disease is the second most common degenerative neurologic disease worldwide. Overactive bladder is prevalent in this population, but can be challenging to treat due to risks associated with polypharmacy, such as with anticholinergics, and difficulty with self-catheterization in cases of retention, such as with Botox treatment. Sacral neuromodulation is an attractive treatment option, especially with the recent introduction of MRI conditional technology, but still remains understudied in the Parkinson's disease population. Recently, Greenberg et al. Published the largest study to date of sacral neuromodulation outcomes in 15 Parkinson's disease patients with overactive bladder symptoms. In their retrospective study, they found 60% of patients proceeded to permanent IPG placement. However, long-term data and success with peripheral nerve evaluation was not reported. The aim of our study was to describe the outcomes of sacral neuromodulation in Parkinson's disease patients using a larger patient cohort with long-term follow-up. We performed a retrospective chart review of 34 patients with Parkinson's disease who underwent peripheral nerve evaluation or stage 1 sacral neuromodulation from 2000 to 2020 at the Cleveland Clinic. Our primary outcome was progression to implant, with greater than 50% improvement of their urinary symptoms. Secondary outcomes included the impact of Parkinson's disease stage and pre-procedural comprehensive urodynamics evaluation, including storage and emptying function on test phase success, as well as the mean change in subjective urinary symptoms over time on available follow-up visits in those patients with overactive bladder and urgency incontinence. 34 patients underwent test phase sacral neuromodulation. This included 7 PNEs and 27 stage 1s. 20 of 34 patients were male with a mean age of 72 years and a median follow-up of 11 months. Indications included refractory overactive bladder in 30 of 34 patients and non-obstructive urinary retention in 4 patients. Norhan and Yahr staging is one of the most common rating scales to describe the progression and severity of Parkinson's disease. It describes 5 stages. We found the median stage in our cohort was 2. Overall, 82% of patients proceeded to permanent implant and 71% of PNEs were successful. Test phase success did not differ based on Parkinson's disease severity or urodynamics parameters. Overall, lead revision rate was 14% and 3 devices required removal. In patients with a diagnosis of overactive bladder and urinary urgency incontinence who progressed to permanent implant, 83% experienced subjective improvement in their urinary symptoms documented at follow-up visits. In these patients, there was also a statistically significant improvement in their subjective urinary symptoms of frequency, nocturia, urgent incontinence episodes, and pads per day from baseline to postoperatively, as can be seen in Figure 1. Most, approximately 68% of patients, were able to discontinue overactive bladder medications postoperatively, and 62.5% did not require any further treatment of their overactive bladder or urgency incontinence. Limitations of our study include its retrospective nature and subsequent inability to use validated outcomes and reliance on subjective patient-reported outcomes as documented in the EMR. Some patients had limited long-term follow-up, and not all symptoms were documented at every visit. Despite this, it's the largest series to date and suggests that sacral neuromodulation is safe and effective in the treatment of lower urinary tract dysfunction in Parkinson's disease patients. In conclusion, sacral neuromodulation is an efficacious and safe treatment option for Parkinson's disease patients, with a high percentage of patients having improvement in their urinary symptoms with low revision and removal rates. P&E and stage procedures are both good options for the initial test phase and have high success rates. No urodynamics parameters were found to predict which patients would progress to permanent implantation. Thank you for your time.